Hello. Good evening, all Foxians and other who have joined today. Today is 291 episode of our Gyan Pravah series, that is knowledge of Pravah of knowledge, stream of knowledge. And brainchild behind this is Dr. Sunita Tandulwadkar, madam. She is Fogsi President 2025. And at the same time, he's having this something innovative idea to conduct podcasts. And we, in this podcast, not only medicos, Foxians, but other specialists are also involved. Even non-medicos, we have taken podcasts. So today is the 291st episode of podcast, and amongst us, we have Dr. Sanjay Paitankar, who is a speaker today for today's podcast. He is going to speak on affordable healthcare. But before we start our podcast, let me introduce our president, Dr. Sunita, madam.
Don't introduce me, dear. We need to introduce only our host, our guest, Dr. Sanjay. And I welcome you, Dr. Sanjay, for this beautiful podcast series. Alka always have got the faculty out of the box. Their discussion is so beautiful. And I'm sure today also the dialogue between both of you will be very good. Alka is known to get the politicians, known to get the film stars, and the dialogues are always enjoyable. So I'm sure, Alka, sir, I joined just to welcome you for 2 minutes that you have come on a Foxy platform. This is our respect for you, sir. And once the podcast starts, I will be joining from the viewers link to listen to both of you.
Thank you, madam. Sunita, madam, just a minute. And one important thing I would like to highlight here, Dr. Sanjay Patekar is from Nagpur, and he's my batchmate as well. And
that I realized.
Yeah. And I wanted to introduce him to this, our Foxians, because he has done a lot of work, charity work as well. And at the same time, he has his Right Health UAE organization, just for the sake of common man, I can say, the underprivileged people. So that is a nice introduction.
Sir. Thank you for coming on our podcast, and I'll join the viewers link. Definitely looking forward to see you sometimes in person, sir. Sure. Thank you.
Thank you. Thank you so much, Doctor. Thank you. So let us begin with our podcast. Sanjay, actually I need to introduce you, but because we have a very important event also, and madam is also busy in organization. And let me introduce to our Foxians and our audience in short about Dr. Sanjay Paitankar. You know, Dr. Sanjay Paitankar, he was a meritorious student. He is a meritorious faculty today. He was a meritorious student of our batch. We belong to JMC Nagpur. And he has, actually his hometown is Nagpur, but now he has settled down in UAE. And he has done MD from JMC Nagpur. He was a gold medalist from Nagpur University. But at the same time, after that, he went to Jaslok Hospital for getting specialized in cardiology. After getting his specialized in cardiology, he started his noble work. And one of the important work, he started working for underprivileged people. And at the same time, he thought, why should not give something else, some different concept to our, we can say our doctors also, or masses. He started his organization, Right Health, and he's the managing director and board member of the organization Right Health UAE. And he's recognized for his pioneer affordable value-based healthcare for blue-collar workers in the UAE. He has given over 30 years of his dedicated service to this class of people. At the same time, he has given many cultural contributions from his side. He has received many awards that we'll come to know during a podcast. What is important is that he tried to develop something new, some new concept as far as care is concerned. And after the introduction of new concept, he followed that concept. One concept is like small margin and high turnover. Something different that I heard for the first time. And at the same time, his philosophy of life is service to mankind is service to God. With this philosophy, he has done a lot of work. So I think I should not waste time in introducing him, because a lot of things will be clear during his podcast. So thank you once again, Sanjay, from Foxy, that you came here, joined from UAE in time. So once again, I congratulate and for best wishes to further work. At the same time, I welcome you. So let us begin our podcast. The first question I would like to ask you, Sanjay, that you had done post-graduation from GMC Nagpur and you were gold medalist from our Nagpur University. Actually, you have family background that your father was a very well-known special physician from Nagpur. And one of the halls in IME building at Nagpur has been given your father's name, Dr. Paithankar's hall at IME building. So he is well known for his as a specialist, but at the same time, you did something for the memory of your father. But इतना सब कुछ होने के बाद में, what motivated you to get shifted to UAE? What was the reason that made you to shift to UAE? Yeah.
Frankly, Alka, yes, I did my MBBS, MD medicine from Nagpur University and did my cardiology training in Jaslo. This dates back to I belong to the same batch of Dr. Alka, 1977, passing MBBS in 81 and MD medicine in 85. I joined Jaslo in January 1986 and was very well trained in doing angiographies and angioplasty. It was just beginning of angioplasty programs in India. And I was trained by the great name Dr. Matthews. And frankly speaking, I come from a very middle-class family. My father used to be the professor and head of department of pathology. In 1984, he retired. You will be surprised in 1984 when he retired as a dean and professor and head of department of medicine. We did not have UGC scales or CPC scales, that is central scheme where incentives, no incentives, only the central pay scales were not there. I remember my father's salary used to be anything between 4,000 to 4,500 rupees. And I had a desire to start my own hospital in Nagpur. And those days, hardly we had a couple of cardiologists working in Nagpur. And my dream was to be a cardiologist where I can come and give good service to my hometown, Nagpur. But while working in Jaslo, and of course, Breach Candy, one of the rulers of UAE had come to Bombay. And I did a successful angioplasty on him. And he was so fascinated because in 1986, there was no angioplasty program in Dubai. So he invited me, why don't you come to Dubai and we offer you a job and you start an angioplasty program. See, my aim of coming to Dubai was very simple, to earn maybe around 5 lakhs of rupees in 1988. Go back to Nagpur, open my own hospital and give service to my hometown. See, that is my karma bhumi. Nagpur is my karma bhumi. My karya bhumi is this, Dubai. So intention was very clear because I did not have even 5 lakhs during that time to establish a hospital. So my intention was to just earn 5 lakhs, maybe more, go back and do it. That's how I came to Dubai in 1988. I landed in, I still remember the date, 26 January 1988. Started working with the government of UAE. And they wanted me to establish the angioplasty program of this place. But unfortunately, you know, the government, how that works, they got delayed. And then I used to be working as in emergency cardiology, trying to help out people. So it was basically the intention was a short-term visit to Dubai, come back in Nagpur and stay with my own people.
So you try to mix the Janmabhoomi and Karmabhoomi because Janmabhoomi is important, no doubt, but Karmabhoomi also equally important because whatever you have learned during your education period, you use it for the people who need it. So exactly the philosophy what you said, the service to mankind is the service to God. So same path I think you have accepted.
Karma Bhumi and Karya Bhumi. Karya Bhumi is the place of work.
Yes, right. So wonderful. Actually, we always appreciate. Yeah. Yeah.
I'm earning money in Dubai, but also benefiting my people in Nagpur.
Yes, correct. Actually, you were in Nagpur, then you got to this. You learned from Jaslok, then you got shifted to UAE. So
Yeah.
actually, tell in short about your journey. This was some milestones, like told in short, to certain points, important points regarding your journey, and whether you were alone during this journey.
Well, it all started off when I joined the government hospital here in 1988, and I was doing a lot of emergency cardiology. And slowly, we had developed the angioplasty programs. The primary angioplasty program I developed, it was by 1990. While working with the government, I realized that a lot many of people who come here and build this Soneri Nagri Dubai are basically the laborers who come from Asian countries, some Arab countries. And in Dubai, you'll be surprised, all these laborers who are building the Soneri Nagri are not allowed to stay in the city limits of Dubai or UAE. There are camps outside the city limits, what are called as labor camps. So it was in sometime in 1992 when I was on an emergency duty in one of the hospitals at 3 a.m. when I was just going back after seeing a couple of patients. I saw one patient on a wheelchair, a Pakistani patient, 25 years old, who was very pale looking. And I asked one of the nurses, what's the problem with this? He said, oh, doctor, he had an abdominal pain and we have given injection, he's going back. 3 a.m. in the morning, I told her, sister, can you do an ECG? People were annoyed with me because, I look only as cardiology point of view. She was resisting, but I insisted and she did the ECG, and to my surprise, that patient had an acute MI. I did an rescue angioplasty, patient survived. And I asked him, Baba, now you are telling me with the history that for the last 3 days you have been having chest pain, and why you have not come to the hospital? The reply what I got from that Pakistani patient who 25 years old, he says, sir, I stay in labor camp areas and I did not have access from that area to come to the city because no vehicles were available. So out of curiosity, I visited the area where this labor camp was, and to my surprise, Alka, there was no motorable road. I had a four-wheel drive that time. Through sand, I could navigate, and I reached there, and I found almost 60 to 70,000 people staying in buildings, overcrowded. I'm talking to you this in 1992-93 type.
Yes.
And in one room, 10 people staying, no medical facility available. The nearest medical facility was approximately 15 kilometers away. No clinic, no pharmacy, nothing was available. Grocery stores were only there. So I said, no, something is going wrong here. So I met few people, laborers there, and they said, no, sir, we have to travel a lot to come to get a basic healthcare in this part. Looking at that, I thought, no, it is my duty as a doctor, because we used 30% of the patients which are coming to our hospitals, government hospitals, were from the labor camp areas. So it was very shocking that nothing was available to them at a nearby place. So I visited that and I thought of opening a clinic and a pharmacy to provide absolutely basic health care to them. And that's how I had conceptualized the start of this clinic, which was quality healthcare at an affordable price and accessible, which is easily accessible at their doorstep. And you will be surprised, we opened our first clinic pharmacy in 1993. Within 3 months, we used to get 200 patients daily, which was impossible for me because I used to work with the government for 8 hours in the morning. In the evening, I used to do absolutely free service to the poor people. But it was becoming impossible because I was working for 18 to 20 hours. So then the demand started coming in from different areas because Dubai was growing very fast. It was becoming one of the top countries. So people from very far off places used to visit my clinic, and you'll be surprised, in those days Indian medicine was available by kilos. I remember paracetamol was available 50 dirhams kilo, antibiotics were 100 dirhams kilo, and we used to buy this medicine in kilos and distribute to the people, and my fees was only 10 dirhams, including medicine. So in 1993, when we started the clinics, we had only 10 dirhams to treat the patient, and people from very different areas were coming long. Some people traveling 50 kilometers, 100 kilometers. That they had a trust that in 10 dirhams, I will get okay in this particular clinic. And as Dubai started developing in various areas, there was a demand from the poor people that please, sir, open clinic in this area. That's how we started off opening clinics in each and every labor camp area where there were no medical facilities available. And as
I think the scenario must change. The scenario must have changed, no? The scenario must have changed.
Yeah. It was only in 2012 that there was a mandatory health insurance introduced in Dubai, where every person who comes from outside has to be having a medical insurance, and that has changed the total scenario in that case. But you will be surprised, my fees are much lesser than even the insurance what they pay us. Today also, we have 20 to 30% of the patient who don't have insurance. So insurance pays me more than what a cash patient is paying us. And it is a most sustainable model where you'll be surprised today also, after 35 years, some of my clinics are in loss, but are compensated by the medicines what we sell in our pharmacies. So the pharmacy compensates to the loss of my clinic business, but we are able to give service. Yeah, and as of today, we have 28 clinics, 28 pharmacies. We have 2 diagnostic centers and our own drugstore. We see 4,000 plus patients every day. I have 4 big clinics which work 24/7 because I believe, very importantly, sickness has no holidays. So we work 365 days a year. And sickness has no timing, so we work 24 hours a day because Dubai never sleeps. Dubai never sleeps. And at any given time, there are 1 million people who are visitors to UAE. So they come to enjoy life, and their sickness starts only in the night. So we serve the people, not only the poor people, but also people, visitors who come in, fall sick. We give them 24/7 services. We are the only clinic group allowed to work in the night.
Okay. Yeah. So I think in Marathi we say Nisha Chara. It must be happening that you are going here and there in your clinic and seeing the patients, watching the patients. So it is very nice, something different. And what I appreciate that this is sustainable. This is not like that affordable and accessible. But you have sustained your efforts. It's still going on in spite of so many years. You are still continuing the same.
Sustainable because I cut down on the cost of the clinic. You will be surprised. Alka, you don't know my other part. I am the architect. I am the marketing manager. I am the finance manager. We were only 3 people running the show till 2018. Myself, my wife, and my brother-in-law. Every clinic of mine is designed by me because I know the rules and regulations of this country, which are very rigidly followed by us, and they are very strict rules. So what are the requirements as a doctor in a clinic? I know it very well. What are the requirements of the ministry is known by me. So every clinic is designed by me in such a way that my overhead costs are reduced. See, all my clinics are not very posh clinic. I'll be very clear with you. I make it an absolutely 100% compliant with the government regulation, but we don't have flashy things. The reason is very simple. When a poor person visits my clinic, the laborer visits my clinic, he should feel comfortable. Tomorrow, if I put a receptionist with a tie and a bow and he starts talking English, the patient will be very uncomfortable. And then they will have a feeling that we are charging them more so that we can sustain our high cost clinics. So my
Yes.
cost clinics are absolutely basic
Without-
clinics. Yeah.
Yes.
So we do cost saving on every aspect. You'll be surprised. I have followed a principle of what is called as multi-purpose worker.
Yeah.
You'll be surprised. The person who is working in the receptionist, I gave him a driving license, so he takes my staff from one city to another city. After reaching the clinic, he becomes a receptionist. Maybe sometimes he's an X-ray technician or a lab technician. So I save a salary of one person. So
Okay.
keeping multitasking people, I reduce the overhead cost. The moment I increase the overhead cost, it is transferred into ultimately is borne by the poor people, which I cut down on 100%. And
Yes.
now, as of now, we deal with so many patients, like I said, 4,000 patients. So for anything, as I have 28 clinics, if I want to buy one pen, I don't buy one pen, I buy 28 pens. So my bargaining capacity has increased. We buy
So
every
you have
month.
developed, yes,
See,
you have developed many skills. I think you have developed many skills
yeah.
during the course of your, yeah.
See, all things what we are trying to do is to minimize the burden of the cost on ourselves, which we transfer it to the patient. See, today if I get
Yes.
if my overhead costs are minimal, I need not add all those costs on my patients. And medicine cost is standardized by the government in this part of the world. We cannot give any discount on medicines. But what we try to do is, for example, there is a bill of 55 dirhams. We don't say discount. We
Okay.
say, okay, pay me 50 dirhams. So 10% discount is it. The reason is I buy bulk. Instead of buying 10 bottles of cough syrup, I buy 10,000 bottles of cough syrup.
Okay. That amount
Because
is saved.
yes. So we cut down on the cost as maximum as possible. And one important aspect is I don't take any gifts from any pharma companies. As of today, we buy almost medicine worth 20 crore rupees every month to be sold in our pharmacies. Now, every pharma company is supposed to sponsor and take me to various countries in the
Yes.
world. Never do
Yes.
that. Instead, I get free samples, which I distribute to the poor people.
Something different. Great. Yes.
Yeah, cutting down on the cost was the primary goal, and offering and quality healthcare totally non-compromised
Yes.
to the poor people who cannot afford it.
So I think that is like saving money and
I
giving it
believe
to
in one
poor.
thing. Yeah, sorry.
Yeah.
I believe in one thing. Health is a fundamental right of every individual, and he has got a right to get a proper health care, irrespective of caste, creed,
Actually,
religion,
our
and
constitution has given us the right. Yes. Yes, correct. Because our constitution, all those things we have already did. So basic things, basic earning, basic what we should say, health, livelihood, nutrition, all these things should be at affordable price, so that they should not be that they are taxed by the doctors. And
correct.
that's why they sometimes go against doctor, because they think that doctors are taking money and enjoying. But you have totally nullified this concept and have applied something new for your patient. That's a wonderful idea. And one more concept I didn't understand, in the sense you have said small margin and high turnover. Is the term utilized in your mission? Actually, what does it actually mean? High turnover but small margin. Yeah.
As I said, the overhead cost being reduced, and I said that some of my clinics today also are on losses, and the reason is we never increase the fees. My consultation, which used to be 10 dirham including everything, ultimately has gone up to 25 dirhams as of today because of the regulations. We are supposed to follow is a minimum fees. But in 25 dirhams, I cannot survive because of the the inflation is increasing. See, my fees has been 25 since last 35 years. Now, how to absorb this inflation, which is almost 3 to 4% in UAE? So we try to increase the number of patients keep our margin of profit. Maybe I get only 1 dirham from the pharmacy, but if I treat 4,000 patients in a day, I get 4,000 rupees from the pharmacy. So that 1 dirham is not a big amount for a poor person. But when I treat 4,000 patients, it has brought a huge amount to our group.
Yes.
And the most important thing is that this is a very sustainable model in developing countries where affordability is the most important factor. See, I always talk about a pyramid in a population. The base of the pyramid is always big where low income people are the maximum numbers. As of today, the UAE population is 12.5 million, out of which Indians are 4.3, one third are Indians. And you'll be surprised, of this 12 million, 4 million are labor class. One third is labor class. And above the labor class are the two thirds. For two thirds, there are hundreds of clinics. But for the blue collar bottom of the pyramid, underprivileged, the number of clinics are very, very, very few. And I'm very happy to tell you that I have absolutely no competition as of today, because we have cut down on our personal cost to the minimum level and transfer that cutting of the cost to the poor patient to make it available. As of today, Alka, my 10% of the day practice is free of cost. We don't force anybody to pay money. If they have money, they will pay. And 99.99% of the patient come back to our clinic and pay the money. If they don't have money, next time they will come and pay the money. 99.99. So
this is very rare to find in such a Kali Yuga, we say, doctor like you who is saying that you can bring it next time, and lot of work without compromising quality. That is important, because you are not just decreasing the fee, but you are giving assuring quality as well. It's not that just you are decreasing the amount of fees. Yeah, quality is very important, that you are ensuring to each and every patient. By the time would you whether you had any problem medically while dealing with such patients, those who are not paid and something like different?
Frankly, yes. Medical legal problems do come in, mostly coming from our neighboring country people. I will not name them. And so they are a little crook people, and we do land up in medical legal problems. Like, they see here the things are very strict. A simple phone call from a patient to the authorities that I was not treated well initiates an inquiry, and till the time the inquiry is not finished, the doctor's passport is held up by the police. So the regulations are very strict here. So now what has happened over a period of time, we have understood what type of people we are dealing with, what type of people they come into the clinic. And the authorities also understand the type of work Dr. Sanjay is doing is to help the people. And today we have reached a level that now the government officials tells me, Dr. Sanjay, there is no medical facility in this area. Can you go and open a clinic there? So we have reached that level of comfort for the government, that they have trust in us to tell us to open more and more clinics in areas where are no medical facilities. And that's medical legal problem. We sort it out. We have all our doctors do have malpractice insurance, but this is maybe once in 5 years we get a case where medical legal problems come in.
Yeah, one thing I just forgot to mention while mentioning about you, that you have developed some healthcare policy, and that is regarding sustainable development. So many things are taught in Indian schools as well. Whatever model you have accepted as regards healthcare, it is taught in Indian schools as well. What is that actually?
Yeah. See, what has happened is that where I developed this model with the small margins and with the high volume turnover, it has become a sustainable model in most of the developing countries. See, what has happened is pre-COVID and post-COVID, and mainly post-COVID, affordability has gone down drastically.
Yes.
See, income has gone down, inflations are going up. So, in areas where the healthcare is to be provided, it has to be an affordable thing. And then what happens is that if you make affordable, more and more people today post-COVID are coming to take advice on preventive things. Before COVID, nobody was talking about preventive things. Today, we are talking about preventive things, especially in labor also preventive things, because they knew that people who had medically fit had a better chance of survival in COVID, and because of that, they are ready to come in and check with us on preventive aspects. Now, as the number of patients are going up, if you reduce the cost, then only more and more people will come. At high cost, no patients will come to you. And this model has been followed in many countries of Africa. And in fact, a lot of universities are using this as a business model for the MBA students, where a very small margin is being used, but at a high turnover, so that at the end of the day, the profits generated are at the highest, and still you are sustainable.
Nice concept, and this is followed in many schools. That is, I'm proud of you, because it's taught in schools, so that the next generation will learn many texts. Next is you have received many awards. Recently, I know you have received fifth consecutive award. So tell us in short, what were the awards, regarding which area or in what field you got these awards?
Frankly, Alka, I never used to bother about what the awards are. For the last 35 years, I am not a page 3 boy. You will never find my photographs on a social event on the page 3. For the last 35 years, always I am in the news for a right reason, that I have done something for the humanity, for the public. It is only in last few years that I started accepting the invitations to attend such functions. And the reason behind it is the work what I am doing is a very silently I am doing the work, but the world has to accept it, that such things can be done and must be done to serve the poor people. So in last few months, I have received 5 awards, starting with the Living Legend Award from Maharashtra government. Then I was given the Icon of UAE. Then I received another Healthcare Leader of UAE by the government of UAE. Then there was an award I received in Nagpur recently as a global icon, myself and the owners of Haldiram, that we have taken the name of Nagpur worldwide. And the 5th award I was given recently during Diwali, where almost 100,000 Indians attended a Diwali function in Dubai, and the government of tolerance and cooperation gave me the award for the outstanding contribution to the healthcare of UAE.
So I think you had done a lot for the masses. So I wish you a few more awards also, because you don't expect anything, but it's like that your work that has proved, and you are there to, of course, to receive the award, because you have spared your life, I can say, many years of your practice for this downtrodden people, or we can say underprivileged people. So once again, best wishes. Sanjay, you had done a lot of charity work. I remember during COVID era, you had some donations to Nagpur also, Nagpur Medical College and other medical institutions in Nagpur. So what was the nature of your donation, of the charity work you had done in India and outside India? Yeah.
See, basically, by heart, I'm a Nagpurian, connected with Nagpur. People in Nagpur feel that I stay more in Nagpur because I visit Nagpur maybe on an average 1.5 times a month. So I visit India almost 18 times, of which Nagpur is always there. And Amravati I visit practically 5 to 6 times. My heart is in Nagpur. I won't call it as a charity work, to be very frank. The first thing I started was way back about 30 years back that IME Nagpur did not have an air conditioned hall for the doctors meet. And that was when I didn't donate. I constructed and gave them a hall with all audio visual, internet connections, air conditioned hall in the name of my father. Then I have donated a chemotherapy ward in the cancer hospital, and I get lot of every year quite number of girls. I get them married for whose marriage has been stopped because of financial reasons. And there are also oration award in pathology because my father has been a pathologist. So every year I have an oration award. I have donated a lot of gold medals in AIMS Nagpur as well as GMC Nagpur. So motivate the students. And I try to go in areas where no gold medal is available. So I give a gold medal where no other person is ready to give. I've been closely associated with the All India Army Women Welfare Association to help them out. And during COVID, the second wave specifically, a very close and dear friend of mine with whom we grew together, our Honorable Minister Nitin Gadkari, he called me, Dr. Sanjay, a lot of things are getting bad out of control here and we need your help with oxygen cylinders and oxygen concentrators. So I was very lucky enough that I could reach all this equipment almost worth $500,000 in 24 hours to Nagpur. And that was a great thing that we could save a lot of lives in Amravati, Nagpur and Gadchiroli. I am for anything. If somebody is in trouble and if I can do it, I'm always ready. See, what has happened, Alka, is you know me right from the day one of medical college. I have earned more money than what I expected in my life, and I don't need this much money. My wants are very little. I still drive a very simple car, so I'm not fan of Rolls Royce and other things. I would like to be associated for a good cause. So anything good cause, they need help, I make sure I don't give money. I am very frank with you. I don't give money, but what is your requirement? I'll fulfill that. I had very bad experience in giving money to people in India where it gets misused. So what I make sure is either through my friends or through my relatives, I make sure the reason for which the money is being given, the cause is attended, and the person gets the benefit.
Yeah. I think I remember one line that greatness of the people is not only because of the great work, but only because of something different they have from the other people. So you had some different idea right from the beginning, and that might have made you successful in your life. And हम बोलते हैं ना, blessings are very important because dua blessings, they keep us going and that inspire us for the ongoing work also. So that must be the success का राज जो बोलते हैं ना, राज behind your success. So that must be the reason why you're successful throughout your career. And you had some cultural contribution too from your side. Cultural contribution also from your side.
For last 35 years, Maharashtra Mandal Dubai I have been running, where we are propagating the Maharashtrian culture in UAE. So we arrange almost 20 big programs every year to showcase the Indian Maharashtrian culture here. This year this will be the centenary of Sahitya Parishad, Maharashtra Sahitya Parishad centenary, which we are planning to have it in UAE for the first time that such a big function is being held out of the country. So I contribute wherever it is possible for me to do it. Yeah. And I'm not successful. Let me be very clear. I'm not successful. What has happened, I have fallen, I have got up, I have again started walking, and I keep doing things. Whether you call it success or not, I don't know. But I keep on doing good things because there is never a wrong time in doing right things.
Yeah. That is also very important. Keep on doing. If you think that you are successful, we stop doing. So better keep on doing. So the next success is there waiting for you. That is also a wonderful idea. And one more thing I would like to ask you. Actually, I remember one event when I was installed at IMA Amravati.
Yes.
That was my installation program. Sanjay specially kept his leave apart and he managed to adjust his leave and program. I remember that day, and you made it possible to attend as an installing officer as president of IMA Amravati. So I should again say you thank you so much because you made it possible. What was difficult for me, and it was a proud moment for all Amravtikars, especially our batchmates, that my own batchmate installed me, who is doing such a great work, pious work, though he's doing it abroad, but it is for people who are from India, who are Indians as well, who are from their city also. So this is a wonderful idea. And last two questions, Sanjay. Actually, what is your future mission? Means you must have some different ideas in your mind that what you want to go into future life as a physician, of course.
Yeah, Alka, what happened is that today we have reached a stage of 4,000 patients per day, and that is full capacity of my clinics. We are unable to increase the capacity of the clinic because of the sizes of the clinic, and here the rents have gone up exorbitantly. So what we have done is we have moved on to starting clinics which work 24/7. So 8 hours work, 8 hours, we initially were doing 8 hours clinic, now 16 hours. Now most of my clinics work 24/7 to accommodate the demand of the patients. That is one. We initially did not have much of specialists because I was only ready to give a basic healthcare which is not available to the poor people. But of late, last 5 years, I have added specialists. I have almost 40 specialists, they work for us. And so again, not only the GP, but the specialist services are also available at a much affordable cost. Now, my mission is to have an hospital in Dubai to treat our patient, because you know what is happening out of the 4,000 patient, and this year next year 2026 our total patients are going to up by 5,000. So every day we generate about 30 to 40 referrals to the hospital. Now what happens to this patient which you have to refer to the hospital? Again the problem comes once we refer to the hospital, the charges are exorbitant. So my dream is to have an hospital where we'll be treating these people at Indian cost in UAE. That's a very big dream. You'll be surprised. I will just tell you the average. See, appendicectomy in UAE costs you around 8,000 dirhams, which is approximately 1.8 lakh rupees.
Okay. No.
I want to do the same thing in maybe 30,000-40,000 rupees. I will do the same appendicectomy by the same doctors in my hospital. So the dream is you don't have to travel to India because you don't have money. Not only the patient's money, but it was the insurance also. I will help them by reducing their cost on hospital patients and treat patients at Indian cost in UAE. That is my dream, and I am very happy to tell you the government is allotting me a plot of 5 acres of land free of cost for this cause.
So I have best wishes, of course, for that, because it's a dream. So every dream should be fulfilled, and you are there. Of course, your hard work is there to fulfill the dream, your mission rather. One off the track question, I should say, you are a great doctor. You are my batchmate, okay, but you are a great doctor doing giving great services to mankind. What about your daughters? Did you made her compulsory to become doctor? It was their choice to become a doctor, not to become a doctor?
Well,
it was their choice.
No. Frankly, see, I believe in national integration. My wife is a Keralite. And it is, I call it again an occupational hazard. I met her in Jaslok when I was doing my cardiology. She was head of ICU and we got married. So it is an occupational hazard, a doctor marrying a nurse. So both of us were working.
Very much lucky for you. She's very much lucky for you. That's such a wonderful work done by you.
the day I got married, the whole scenario has changed. I've become very lucky. So what was happening was both of us were working with the government in UAE, and my kids have seen the hardships of life. She was doing night duties, I was doing night duties. Sometimes my wife is going on night duty and I am coming back home. So mother is coming, father is going, father is coming. We did not have proper weekends together. So they had seen the hardships of life, and that's why they had determined not to be doctors. And I did not force them, anybody of them, to become doctors. I have two daughters. The elder one is an architect. She works in Los Angeles as an architect. She has done masters. She is very well settled there. My younger daughter is into finance. She has done masters, and then she has done the CFA. She works with the ruler of UAE. And both of them are not into my profession, and both of them are not interested in joining my profession or even my business. You can say they are very happy with them, and I'm also happy that fine. They let them be of whichever interest they have to pursue it. I have full support of my wife today also. She manages my house. Uh, I'm a great host. Everybody knows it in India. We
Yes.
get almost 100 people for dinner or lunch in my house every month. Just imagine 100 people visiting my house in Dubai every month for lunch and dinner. So she takes care of all those things, and I help her because I am a very good cook.
Yeah, actually, that is great. Hospitality, everybody believes in your hospitality and they come to you and meet you. So actually, this is a wonderful opportunity for all of us to meet you and enjoy your hospitality. So once again,
All,
because what
all
happens
your all
nowadays, yeah,
your association members, if they come to Dubai, please let them to meet me. I will be a very great host to them.
yes, yeah, thank you so much. And last question, of course, it is message for our young doctors, because what happens nowadays, parents start influencing their ideas upon their children. Because they are doctors, they should become doctors. The current generation is not like our generation. They have something different ideas in their minds. So they should do what they want to go for, and should not be like, we should not influence their ideas or their
See, I'll
thoughts.
tell you very frankly, there is no point forcing the newer generation to follow the parents' profession. See, a doctor's profession is a learning your student for life.
Yes.
You have to learn throughout your life. And if you say that I will become a doctor to earn money, then you're a wrong person. You're a wrong person. Unless you have a passion of healing somebody, don't become a doctor. Because if you don't heal somebody, you're hurting somebody in a not an emotional manner, but sometimes in a financial manner. We see in India, doctors have become commercial. See, take my example. I have achieved so much in my life. I never ran behind money. And then, see, money will never get you happiness. Money will not give you health. You need to earn these things, happiness, health, by yourself. And the best way is you should have a passionate heart to heal somebody's uh, pain. And unless you have that, you should not force anybody to go in for this.
Yeah. So actually, it is healing. These are the healing hands, and we should not force them to another unless it comes from their own soul. So just last line from you, Sanjay. This is for our young generation doctors. Those who are already doctors and in medical profession. One line message for these young generation doctors.
Don't run behind money, the money will run behind you.
Yeah, that's a wonderful message. One line message, because Saraswati and Lakshmi, they stay together, but use your Saraswati to get Lakshmi. But don't run after Lakshmi. So once again, wonderful podcast, though it was a short of time, but you manage it properly. And
Yeah.
once again, from Fogsi, from presidents, on behalf of president and of Fogsians, I should thank you to give certain new ideas that will give us introspection amongst our juniors and of course ourselves, that we can do many things for our community, for underprivileged people, and don't run after money. That was a very wonderful message. And we should try to utilize our skill and our strength and of course knowledge for the betterment of society. So what the blessings are very important. That's the thing which will be sustainable, which can be sustained, sustainable. But
Yes.
money, today we earn money, tomorrow we spend money. But these are the blessings which we nurture or rather we have when we do some good work for the society. So once again, thank you, Dr. Sanjay Paithankar, for
Thank you.
sparing your valuable time. So you are busy in your practice and other things. You just know we have great podcast with you. So thank you from our Fogsi Association. And
Thank you.
thanks technical team as well for giving us wonderful platform. Thank you, Sanjay.
Thank you. Bye.
Meet you soon.